Greetings. Hope you're all well tonight. Had a good first day, as I did. We've got a pretty sore subject tonight because it's a disease that probably everybody here has affected their family at one time or the other. You may even be dealing with somebody now with dementia, which is mostly a little more than 50% Alzheimer related disease. I don't even know why they still call it dementia. That's kind of an old fashioned term that PR might say, let's get rid of, or PC might say, let's get rid of that. It's not really politically correct to use the term demented in any aspect, yet we still do. Now, I want to take a little time to talk about Alzheimer and specifically, and then look at a case history, and then hear what you have to say about it, how you've dealt with it with your relatives in the past, or you may be dealing with it right now. It was once upon a time, not that long ago, that the only way you could tell if someone had Alzheimer's disease was by an autopsy, because they had to actually look at the brains to see if they could establish that the patient had tangles in their neural nets, tangles almost like curls, where the neurons would pretty much dry up and curl around. At the time, 25 years ago or so, they considered that this was caused by possible genetic problems, possible, but primarily the ingestion somehow of aluminum molecules. Now, how the aluminum got in there, nobody really knew, because the aluminum molecule was too large to get through the blood-brain barrier. But I know I had a grandmother that had early onset Alzheimer's disease that I'll talk about later. She used a lot of aluminum-based face powder and had all her life. And the only thing I can figure as far as the aluminum is that using a face powder and inhaling the aluminum molecules, especially through the nose, up through the olfactory nerve, that's the closest place or the most easiest place that an outside affector can get into the brain itself. Still, that doesn't take away the problem of the blood-brain barrier, which is still, the openings are too small for the Alzheimer molecule to get through. So what they did at that time, and I'm not talking about any more than 20, 15 years ago, was there were certain symptoms that they could determine if that patient had these symptoms, that they most probably had Alzheimer's disease. Of course, they're not going to test everybody that dies with dementia with an autopsy and see if they've got the disease or not, or the nerve tangles. But the symptoms were aphasia, that is, problems with speech. In fact, I've actually defined these tonight for you. Aphasia is an impairment of language, affecting the production or comprehension of speech and the ability to read or write. The second diagnostic tool was apraxia. That's a neurological disorder characterized by the inability to perform learned, familiar movements on command, even though the command is understood and there's a willingness to perform the movement. For some reason, the command just doesn't make it through to the members that are commanded through the brain. It doesn't get through somehow. The third is agnosia, or a type of agnosia is amnesia. It's the inability to process sensory information or remember it. Often, there's the inability to recognize common objects, persons, sounds, shapes, smells. While the specific sense is not defective, nor is there any significant memory loss. Like the grandmother I was telling you about with the early onset, began to go blind in her 40s, and by her mid 50s, she was legally blind, but there was nothing wrong with her eyes. There was nothing wrong with the actual organs that did the sensing. Rather, again, the signals somehow got mixed up in the tangles of the brain. And the fourth was added later, eschadia. In fact, I am thinking that I probably coined this term because the rest of them are good old Greek negative terms. But eschadia is an impairment of the ability to plan or organize, do things in sequence, or use abstract reasoning. And as I said, Alzheimer's is the most common form. When they do the autopsy, a second way that they're able to diagnose this is that there is a propensity of amyloid, a sticky, viscid protein that is into the brain. And what they found since then is that some people have a gene, or I should say a genetic defect, that at a certain age or stage in their life, or when certain other genes turn on, these genes that make amyloid protein just go crazy. Amyloid is able to go through the blood-brain barrier and to go into the neurons of the brain and just simply gum them up, stick them up. So we usually think of people with Alzheimer's disease as being very old, but more and more we're seeing, because people are living longer, we're seeing Alzheimer's disease starting much earlier, in the 40s and 50s. And somewhere around 50% of people over 85 are affected to some degree. What I learned when I did a little paper on this back in college, in the days before they had genetic testing, was that if you had one parent with Alzheimer's disease, you had a 50% chance of having it yourself. If both parents, 100%. If one grandparent, you had a 25%. It really broke down well, I guess. Two grandparents, 50%. Three grandparents, 75%, and so forth. You might think of that when you are looking at your older relatives that certainly have the symptoms that you can tell of Alzheimer's disease, in trying to guesstimate where you're going to be at the same age if you happen to live that long, and if there's not a cure by then. We're certainly hoping so. Sufferers are usually going to deny that they had any problem at all at the beginning. And often because they don't see their own problem, they're going to be fussy and blame others for those problems, but they do recognize them. Structural changes in the brains of Alzheimer patients are excessive, very, I'm trying to think of the word here, very, not modest, but great changes, we'll put it that way, because this usually progresses quite fast, and there is certain drugs that will help the Alzheimer patient to conquer some of these deficits, the aphasia, praxia, amnesia, etc. But there is no cure for it as yet. At the time that I was doing my paper, they didn't think much of it was genetic. But now they're thinking up to 80% or more is genetic, and the rest still they don't understand what the cause is. Stay away from the face powder. That's all I could say. My grandmother, if you, she was like the character on, we'll look at a television show you might be familiar with, Keeping Up Appearances, a British television show starring Patricia Rutledge. Does anybody remember that show?
I actually do.
Okay, you remember the lady of the house, Patricia Rutledge, was on a very modest income, but always trying to keep up with the Joneses and keep up
Yes.
appearances. And in fact, her last name was Buzzard on the show, but she pronounced it Buzzard.
That is correct.
Yeah, okay. Well, my grandmother was very much like that, very much like that. And it got worse and worse until she got in her late 60s. And then something happened. It really showed me something, and maybe it'll show you something. Though the disease didn't stop progressing, she went to an Ernest Angley meeting and was prayed for. And she came out of that meeting like a new person. Her cognizance wasn't much better, but all of a sudden she became sweet and loving immediately. And so we had quite a few nice years because she lived to an old age where our grandmother, or my parents' mother-in-law, turned out to be a very sweet person when before she was very hard to deal with, at least for my parents, not for me. Of course, I was the baby of the family. I mean, I should say the firstborn, so I got everything, you know. And I've got a case history here that I'd like to read to you that really puts a finger on this. And then let's talk about your experiences and also what we can do spiritually or with inner healing to bring about some relief. This comes from the wife, Margaret, of a husband with Alzheimer's disease. The title of the essay is My Husband's Brain Stopped Working Properly. About 8 years ago, my life changed 100%. The reason? My husband's brain stopped working properly. We'd been married 34 years, and Fred was 67 years old. He'd worked for the same construction company for 32 years, first as a laborer, then as a security supervisor and union leader. He was a big, strong man, a good husband, and a good father to our son, Mark. Together, we'd managed a good living, the original odd couple our friends would call us, with him in construction and me an actress in television commercials. Life was good. And then the brain went downhill, taking Fred and me and Mark along with it. The problem seemed to be small at first, hardly noticeable, really. Sometimes when telling me about his day at work, Fred would talk about the foreman, Jimmy, driving a tractor when he meant a bulldozer. He'd say that he had made a revision instead of a decision, just little stuff, and he'd catch himself, kind of like I'm doing these days. I didn't think much of it at all, but it was odd. It doesn't sound like much, but it wasn't like him. I even thought, oh, well, the old boy's slipping. And I would laugh to myself. But when he forgot the anniversary of our first date, well, I knew something was wrong. I gave him all kinds of hell for that, accusing him of having an affair, cried, and let him have it. But I was also scared. I mean, maybe an anniversary like that doesn't mean much to other people, but for us, well, over the years, he'd taken me to Atlantic City for shows, to dinners in expensive restaurants. Maybe they should have gone to church. Once, after Mark was grown, he even got us a hotel room in the Catskills for a weekend. There was always some sort of surprise. So 8 years ago, in anticipation of that special evening, I got all dressed up. When he got home from work that night and sat down on the sofa, I knew he'd forgotten. And when he saw the disappointment in my eyes, he realized the same thing pretty quickly. In fact, he was beside himself and took me out to a very fancy Italian restaurant after I calmed down. But it was a bad sign. That year turned out to be a rough one. It wasn't that he suddenly forgot everything, but it seemed like he was suddenly forgetting a bunch of things when he'd never been forgetting things before. I'd always been the one with my head in the clouds, forgetting and losing things, not Fred. He'd be the one telling me, Maggie, you've got to stay more on the ball. If you forget to pay the bills, they're going to shut off our electricity. Or he'd chew me out about forgetting to make a doctor's appointment. For Mark, of course, I'd joke, why don't we switch jobs and you'll see who's got it tougher? But he definitely had a sharper head, no denying that. Now suddenly he was losing his wallet. And we'd find it later in the study where he'd sworn he hadn't been in days. Or he would leave half-drunk glasses of juice on the floor of the living room, and when I'd chide him about it, he'd say, oh, I'm sorry, and change the subject. But this was Mr. Neat Freak, who, in past times, couldn't stand it if a dirty dish sat on the kitchen table more than a half an hour after dinner. He also had little accidents, spilling food on himself or knocking over a pile of papers and the jar of pencils from the counter. Then he started asking me to drive him to work all the time. He said that he'd caught himself veering off the road a few times and just had barely avoided an accident. It's all the stress, he'd tell me. We've got a new contract coming up, and I don't think it's going to go our way. I just got too much on my mind. As the forgetfulness and unusual behavior mounted, it couldn't be ignored anymore, yet somehow I found a way to do just that. I wanted to believe him. Then one day, he missed a meeting with an important contractor. Just didn't show up. Instead, he went to his office like it was any other day. The company had lost that contract and a lot of money, and it also was bad for their image. Actually, by that point in time, I wasn't all that surprised by his error. This strong and organized man who had taken care of me for so many years was by then becoming a different person, and I was becoming used to taking care of him. That's when I told him that he must see a doctor, and Fred did something I had never seen him do. He burst into tears. Hey guys, I'm reading my story here. This is my story. Only I've read about enough about this and had enough experience with it to at least recognize it in myself. And it is scary. I've got two grandparents. Gives me a 50% chance. I've known this all along. What to do? It's time to do something. What can you do? You can go and get a neurological test. I've asked the doctor. What do I do to find out now? A neurological test will do that. That's an outpatient procedure. If you're having the same symptoms and you have it in your family, it would be a good thing to try that, because I'm encouraged that there will be a cure for this in the very near future through genetic testing and recombination. Genetic recombination is not evil. It's a person that is evil that would use these for evil things. This kind of science is the greatest hope for all our problems that has ever in the history of the world come upon us. And look, you say that the millennium is close by. Wouldn't Elohim wouldn't Elohim be giving us something a little more sophisticated than a tree with 12 leaves on it? This is symbolic for something big. Check into it. Learn more. This time is upon us. I hope that well meaning believers only look to where this technology is used in an evil fashion and not in a good fashion. Seems like they want to banish all of it. This is important for our future, for the future of believers, and for our eternal life. We need to talk about that sometime. Despite his emotional outpouring that evening, Fred managed to put off medical treatment for nearly a year. However, eventually the incidents caught up with him. For example, leaving his glasses in the mailbox or mowing only half the lawn. And he went for a neurological exam. There. A battery of tests revealed some cerebral damage, and the neurologist, Dr. Schoenfield, broke the news to us that he was suffering from a form of progressive dementia. He explained to us that we would be facing a very difficult time and a great battle, that Fred would, over the course of the years, become further incapacitated and less able to take care of himself. He also told us that very little could be done to stem the progress of Fred's condition. Fred was going to have to be very reliant on the support of his loved ones, particularly me, to see him through this. Well, they say now, especially when you're in the later stage of this, your caregiver is the one that really suffers. And I hope we can get somebody to talk about that in a little bit. Fred had already planned to retire, as his position in the company had been scaled down drastically after the contract debacle. The doctor's diagnosis simply made it official in our minds. Within 3 months, he was thrown a retirement party by his coworkers, many of whom he had mentored. By then, he was having trouble remembering people's names, but that party meant a lot to him. He knew just how lucky he was to have so many caring friends and colleagues. He was still embarrassed about having lost that contract, but everybody tried their best to show him that they had nothing but gratitude for his years of service. He wasn't walking too well by then, so I helped him to a chair where he sat for most of the party, sometimes crying quietly to himself. He no longer had full control of his emotions. I think that was really his last great time. The last time he had a real special night out. At the party, Fred gave a short talk to his coworkers, thanking them for the event. He'd been worried about his speech beforehand. He feared attempting to reminisce or trying to be too specific because he was having so much trouble remembering things, and he didn't want to read a speech off a paper. So he preferred to keep it short. It broke my heart when I heard him say, "This is really a special night. I want to thank you all for this and for helping me out the way you've done the last few months. I'm not the kind of guy who takes a lot and makes the big speeches to his friends. That's what you are, my friends. That's why I've had a great time all these years. That's why I've loved my job and going to work in the morning. We've had a lot of good times, and I'll miss you, my friends." It was more than a retirement speech. It was a farewell speech, and it broke my heart. But as painful as that was, The impromptu speech that he gave to me alone just 2 days later hurt even more. He was lucid that day. He was clear and organized and sharp as a tack, just like the old Fred. And he was hurting. This is so sad to see these people decline through the years. Another thing in my family, my mother, when I was a teen, she owned a nursing home. And I worked in another nursing home in another town. So we would work with these old people, both at home and in our own places. As for me, I was in charge of 12 men, every one incapacitated by late stage Alzheimer disease. I tell you, I did it for a summer. That was the hardest summer of my life. But on the other hand, I have stories to tell about that, and even a story of a miracle that I witnessed. So I've had a special heart for people with Alzheimer and other types of dementia. It's important when we go in a place where we can visit such people that we don't fall to pieces. If you've got older relatives in the family, all you have to do is consider them as the same as always, but know they're going to have trouble, and speak to them. They might not even respond to you. But in speaking to them, you never know what's working and what's not. That's something that we should keep in mind in the restoration of creation. Our population is getting older and older. Look at yourself in a mirror. Look at yourself. We are getting older and older, especially we who are in the generation just after the war, because there are so many of us. They say that before long, if not already, we're a burden on the system. And certainly the burden gets greater every day on the government and its programs. What will we do? What can we do for those on the margins now? Go to a rest home. See how many elderly people are sitting in a wheelchair drugged. Yes, drugged. Out in the halls and in the various rooms for visiting, sitting with their heads down. It's not because they would sleep normally, but they're given a little drink twice a day to keep them docile. Oh, what do you expect is going to happen to them day in, day out? In that nursing home that I worked in, every time, 2 times a day, a little cup, a little cup. And one that would be fluid in their speech 1 minute would drink the cup because they were made to. And an hour later, and for the rest of the day, a, a vegetable, a pitiful vegetable. What can we do? Allison, can you share a little about, we know what you're doing now, but maybe you could share a little of your problem and some of the things you've used to cope.
Sure. I would like to put a link in though to a site that I've found, or this particular teacher has shown me a lot on understanding all of these things. Her name's Teepa Snow, Teepa Snow, and she's got a very down to earth, hold on, and practical but very, very kind way of dealing with people who have these issues with their brain. And I'll put the link to one of the videos into the chat here. This is the 10 early signs of dementia. Okay, she's really, really pretty amazing. She's got a really sweet but like I said, common sense approach. But yes, I take care of my mother. She has probably middle to moderate to heading on to severe dementia. It's vascular in nature, from having many strokes and a bad heart valve. And you can see, I've been here almost 2 years, and you can see the differences since she's been here. It's a little bit more every month. Um, you have to remember, like what Jackson was talking about, those 4 or 5 words that start with an A. My memory isn't the greatest.
We'll
Never
sing a
was.
song about it. Then we'll
Yeah.
learn it.
So the, at the stage she's at now, she can't remember the words she wants. Like, she just went through an attack of shingles, and she keeps telling me she needs her face washed. Well, it's not her face that she wants washed, it's her eye, but she can't tell you it's my eye that's, gummy from the shingles. She just says face. So you have to pay very close attention and try to figure out what they're talking about, because they just don't have the words. If you try to say, please, will you sit in your chair and I'll bring you breakfast, they look at you like, what? If you gesture, and she is legally blind as well, but she can see movement. She has shoot, I can't remember the name of it. It's a degenerative disease of the eye. And
macular degeneration?
Thank you. Yes, that's it. And no, I'm not slipping down the hill here. It's just I'm a little nervous talking on the camera. But she has macular degeneration, so she can't see out of the center of her eye very well, but she can see motion. But if you gesture, they get the gesture a lot of times. That's normal for them to remember that, because it's such a basic thing, and it doesn't involve the language. And language goes away, logic goes away. You can't reason with them. They don't. Their brains are actually, the way this lady Tipa Snow explains it, their brains are actually shrinking. And I think that the language stuff is up in the front, and it goes pretty soon. And she provides a lot of slides of what a brain looks like, a healthy one with all the electricity running through it, and then one with dementia, and it's very dark. Or Alzheimer's, it shows different segments that are dark, but they're very dark, and they're actually smaller looking in mass. It is, she calls it a disease. It is, as far as I can see, it's defined as a condition.
Yeah, they shrink and fill up with amyloid.
Yeah, and it fills up with some sort of plaque protein.
Yeah, amyloid protein.
Yeah, but it's difficult to communicate with them. It's difficult to help them. And I see, she forgets the order that things go in. Like if she's trying to to put her clothes on, sometimes she needs assistance because she forgets what order that all clothes are supposed to go on, and she'll just stop and get confused and sit there. So, and I try to respect her privacy and let her do as much for herself as she can. I mean, who wants somebody else in their business all the time? But if she's not there for 15 or 20 minutes, you need to go see what's going on and help her. She doesn't know who I am most of the time. She thinks I'm a nurse or something, which is okay. She's usually very nice and sweet until she gets, they get very hyper focused on one thought that will loop and loop and loop and obsess on it. And then you have to distract them if you can. It's like, would you like a cookie? Or would you like for me to bring you the cat over here to sit with you? Or can we watch something on TV? Which is more, I think I know she can't follow the shows, but she likes hearing the sound and seeing what she can see on the screen. I guess it's, the sound of another voice. And the thing that's tricky though is that they say that your social skills that you learn how you interact with other people, are so deeply ingrained that she sounds fairly normal when most people who don't know her come and visit. And it takes a little while for them to figure out that she's not quite in the same reality that we're in anymore, and it's devastating for people. I try to tell them, but they don't understand. And it's, that person is in there, but is not quite the same person anymore. It's very sad.
What's it do to you? That's
Actually,
a caregiver.
Well,
I mean, you're a busy person. How you do it, I don't know.
well,
If you don't mind.
no, for me, it's an exercise in prayer and patience. I'm not a particularly patient person. So that has been a challenge. And, this lady that I recommended, Teepa Snow, she describes the different kinds of personalities as a jewel. You have to find what jewel is still in there and how to reach it to make them feel comfortable, make them feel happy and less lost and frustrated, because they get frustrated. And, if I can find the right way to work with her, she's just sweet. And I think my mom likes to be treated like she's a pretty little girl. Fuss with her hair, tell her she's beautiful, fix her face up, give her a nice new sweater or something. That just makes her beam. And I think it improves the quality of her life greatly. But when you get asked 15 times in 10 minutes what day it is, day in, day out, it gets a little hard. And that's where prayer comes in. I try to be the person that my master wants me to be,
Can Jack, can I interject something here?
Go ahead.
One of the things that I learned as a result, because my aunt, she also had Alzheimer's. And one of the things that, I learned going through that process, and it wasn't long of a process. A lot of people have come, and the account that you were reading, Jackson, about Fred's case study and how it was a slow creep towards, whatever. I'm thankful that when my aunt's was discovered, that it wasn't long, because she knew the words of prayer, and she knew that the Father's word was the Father's word, and that he would never leave her nor forsake her. And when that time came, the Father took her home. Now, one of the things that my cousin was always good with is that she always treated her like she was still the same individual. And I didn't notice any bad days when I would go over there to visit for Thanksgiving and stuff like that. She didn't have any bad days. I mean, we had conversations, and she could take me way back. But it's there. It has to be dealt with. But one of the things that you have to make sure, and this is just a word of encouragement. Sometimes, Allison, you would talk about when you get asked 15, 20 times in 5 minutes, it's just one of those things. Sometimes you have to just, even if they're having a bad day, you just have to agree with them and move on, because it is what it is.
Oh, yes.
And when you try to reason with them, or I would even dare say sometimes distract them, it's almost like, okay, yes, once a man, twice a child, and that is what you're dealing with. You have become the adult, and they have become the child. And, I never saw my aunt in any situation where she was had to be treated like a child, because, it just was what it was. So sometimes we have to remember that, you know, we have to keep our wits about them, us, because they are going through that time of brain shrinkage and this plaque forming on their brains. And they're going to lose a lot of abilities.
Yes, and you're right. You have to really put yourself in their shoes and try to understand what they can understand, and that they didn't do this, they didn't want to be like this, you
Yeah,
know.
right, right. There's a case that I had in a parish where a wife was diagnosed with Alzheimer, and the doctor gave her caretaker, who was her husband, both elderly, a book to show him the progress of the disease as she went along, because you know there's really not that much they can do for him at this point.
Mhm.
And so it came to pass that the husband died,
Mhm.
and in going to the wife now, she only had the ability to say one phrase. That phrase is, "It's in the book." She would say, "It's in the book." That's all she could say. It was echolalia from what her husband said, because every time that she progressed a little bit, he'd go to the book and he'd say something like, "Yes, it's right here. It's in the book." So she ended up with only the ability to say that when the caretaker was gone. Now,
Wow.
that's something to think about if the caretaker is near the same age or near the same health as the patient. Because what if that caretaker would happen to go first? Of course, she ended up in a nursing home because the daughters couldn't help her anymore. Besides, they have their own kids and their own lives. What could they do? To do much took a lot of money, money that we don't have for such things. Anybody else want to describe their experience?
Yeah, I'll describe a little bit. Even though I wasn't as involved as my sisters and some of my brothers were with my mom, but um, there were signs like she stopped driving when she was 76, because I think she knew that something wasn't right because she would probably go a little fast. I don't remember having a heavy foot, so
Mm-hmm.
when she was earlier in life, but you know, um, since I wasn't around too much, I didn't notice too many signs. But then we family told me in the 2015 or something like that that there were things going on, and the doctors they're pretty good at the diagnosis thing. At one point they said that it would be 3 to 6 months, and when I came home that year and observed, and saw her, they had a hospital bed for her and everything, and they took the carpet out of her bedroom. It was just a tiled floor, and she was definitely different. Had a walker. Um, Sometimes she was quite lucid, and other times she was not. What she would say would not make any sense.
Yeah.
How or and I heard about some things. She told one of my nieces. She said something about, "Do you hear what they're saying about you outside?" And my niece like, "No, what are
She
they
probably
saying?"
wasn't wrong.
Well, maybe at one time. See, I do believe that somebody, who's had a long life like that is probably just, a lot of it is, they are definitely unmoored from time and
Mm-hmm.
space. So, I don't know how it works, but they're remembering things, and some of the older stuff they remember real well.
Oh, yeah. Real
Um,
well.
and
Too well.
so it might have been a time when my niece was being talked about outside, and she was
30
talking
years
about it.
ago.
Yeah,
Hmm.
yeah, 30 years ago, she would have been a real little kid then. My niece would have been. But so it's and I saw her, and we had to put her in a nursing home before we left. This was a little after New Year's of January 2016. We put her in a nursing home because it was getting to where she couldn't stay in bed. She also had Parkinson's, so she would try to move or try to walk or something like that, and then she'd fall. But somebody said, I think it was the doctors that said that it's probably a good thing that she can't remember, because she would be totally dejected if she remembered that she tried to move and couldn't.
Yeah.
So we had to unplug the stove and all that good stuff, and people couldn't stay 24/7 with her. Um, and it's interesting, or it's you see somebody who was extremely independent, who cooked, who cleaned, who did all this stuff, and up until maybe a year or two before this, and and she was always the one to do everything, and now she can't do anything at all. Um, so we put her in the hospital, or in the nursing home, and fortunately for her, she said there was family lives around there, even though I went back to Chattanooga and my brother went back to Detroit. But there was a lot of family around there. They visited her every day, um, sometimes multiple times a day, and they were there almost constantly during the weekend to make sure that she
That's
was
good.
well taken care of. And but when they don't remember stuff like your birthday, because and sometimes she wouldn't know who she was talking to on the phone, because I call and talk to her and stuff like that. And there was always family there, and they'd have to tell her who I was sometimes. Like, man, this is
Hmm.
no joke.
Yeah, no joke.
Even though there were some of our family who were kind of sanguine about it. One of my nieces was she was pretty real about it and told me everything. And then other people, I'd ask them, and like, how is she? And she says, oh, she's fine. Like, well, you're not, my niece told me not exactly fine, but um
You think
so
you think that's a type of denial?
in
We
some
got
way
we got to use a little humor here because I can't stand to think about real
it is
things.
a I think it's a type of denial. I mean, they obviously see her, they see her in person at least once a week, if not more. So they know what's going on. And actually there is um there is a also in a way that how we are taught to deal with death, or the realization that it's going to come. There are some religions and traditions that do better with that, like Judaism. You've got the idea, I'm not sure how they deal with death approaching, except that it's accepted that it's a part of the cycle of life. But when it does happen, you've got the funeral, you've got sitting Shiva for a week, where the people come and sit with you.
Hmm.
And for a month, you say the mourner's Kaddish for, every day. Then for that next 11 months, you say it once a month. And then from then on until you go on yourself, you say it every year for that loved one. So it's a constant recognition that, yes, it happened, it's going to happen. And if you've lived long enough, you'll have said it for many people,
Hmm.
and honored many people this way. But there are some places in which Protestant traditions, where the idea of the homegoing service um, is they're going home, but you're not allowed to be sad. You're not allowed to mourn. You're not allowed to properly grieve, and so people never grieve, and then it's held in, and then these people end up falling apart later.
That would be something really worthwhile of talking about in another program. Where what about these customs that we have with death? I know, dealing with people in the Philippines now, they lay the deceased out on the kitchen table, and people come and eat with the deceased person for a week or 10 days afterwards. I mean, that I just can hardly I can hardly get a hold of that. But you're talking a little about the spiritual aspect too. One thing that I found helpful because I've been around these folks a lot in my life. We always had several elderly people living with us. Now, my mother took care of them. She just loved people, and these people were helpless. One thing is, again, the doling out of these drugs, because they undoubtedly must speed the disease on. And the second thing is that, especially we believers, we forget that these people are an open opportunity for evil spirits to come right in. I tell you, I've heard people that I knew that went into dementia, that all of a sudden they would have outbursts and screams and things they said that you couldn't possibly imagine would come from their mouths. And you could almost see their faces and bodies change when something
Absolutely.
comes in there and takes over. I told you the story about the Baptist deacon that was hit by the van and became a quadriplegic, and laying on that hospital bed for 2 years, and something coming into him that just made him crazy. And you'd go around and pray around him, he would go crazy, turn colors, and writhe around like a snake. Well, you've seen this before.
Absolutely, yes.
One thing we can do, though, if we ever have a chance to visit these folk, and we ought to make a chance if possible, is before you get in the room, start binding that up. And
Amen.
even when you're in the room, to pray in tongues if you can do that, or pray in English, whatever, under your breath the whole time you're visiting, especially if you see an outbreak like that happen, because that can be frightening. Literally could scare you to death. Another
Jackie, you
thing
hear
is,
me? Oh, go ahead.
yeah,
I'm sorry.
another thing is that people don't usually die of Alzheimer's disease or dementia. Because of their incapacity, they'll fall down and break limbs, or they'll acquire, their immunity will be down. They'll acquire mainly pulmonary diseases, lung diseases, cancers. Pneumonia is one that takes them. If they have a genetic connection there to one of these other genetic diseases, they will go faster that way. So that's another thing to think about, because when one of these patients that's even on the early onset of one of these diseases falls down and breaks a hip, you know what's going to happen when that's fixed? They're going to fall down and break the other hip, or they're going to fall down a flight of steps, and it's going to kill them or incapacitate them to make it all the worse. So again, when we have these caretakers come in, we've got to really qualify these people.
Hey, Jack.
Yeah.
There's a related account I have, I heard about. I unfortunately couldn't find it to read it. It's on a group that me and some other people are on, but there is a lady who has a 9-year-old child. She's carrying her up and down the stairs. And, she can't, I guess she can walk, but she can't do stairs, the child. So, or she can't walk at all. I'm sorry. She's non-ambulatory. So she can't walk, but, she's saying she's so tired and exhausted. And it's like, so the one thing you should do is get a different house that doesn't have stairs, that doesn't have a need for stairs. Yeah. That would be first. Or if you want to get a multi-level house, make sure you only got like 3 steps or something instead of 10 or 20.
Exactly. Now, there's another account you talking about, Jack, about when these people have dementia and Alzheimer's, and how they have the outbursts. I know 2 accounts. One was from a sister that was in the church that I was growing up in. She was a nurse, and she told me that she was doing what was called private duty for a family. And she had this man that she was taking care of. And he, when he got dementia, and here's the thing, when you go into dementia or Alzheimer's, whatever's on the inside is going to come out. And the one that she was doing, Sister Williams, this was a mean, no good old man. Okay?
Uh-huh. Yeah.
He was a no good man. As a matter of fact, when he died, a couple of days before he died, he said he'd see the demons. And he said, I see you. I see you. I'm not going. I'm not going. And he would scream this stuff out. He would scream this stuff out. Get on away from here. I see you. But when I said, but when that time came, she said them demons drug him off from there. And so whatever, he was mean. He would do things. He would try to pinch her. He would try to bite her. He would try to hit her. I mean, the things from back in the 60s and the 50s and the 40s would come out. And it's just terrible. But she was right there. She took care of him, and right up till he passed away.
Yeah.
And when he passed, it was not pretty. So there's some that say that there's not a hell. I truly believe, after hearing that there's definitely a hell.
Yeah, it would sure lead you to believe that way, especially if you had delusional patients seeing demons running around. I've heard of them seeing dogs and cats running around a lot and talking to little dogs that were there beside them and all. But, you know, when you get these changes like that, of course, the doctors attribute them to the disease, but sometimes something clings into diseases, especially when someone like that is helpless.
Yeah, I've got a little experience in that here. And I didn't know that was one of the things you were going to bring up. But I think when I'm doing something with this group, like online, or I'm trying to study or get some work done to do a presentation, sometimes my mom will get very agitated and sharp with me and just mean. And, you know, she gets a different look on her face, a very peevish little look. And if you bind, like you were saying, you bind whatever's in her ear, whispering to her or giving her a hard time, and it doesn't take long, and she'll go and settle down, and she's fine again. I think, and she was one of the very, very holy natured person her whole life, and she loves Yahweh, only she doesn't call him that, and his sons. You know, I don't think that it matters. I think that as your mind gets weaker from this disease and this progression, probably the adversary really enjoys toying with.
I agree. That's a kind of a bastion of evil. My question would be, yes, we can bind them, but do you think we could actually cast them out of such people? I've never had the chance to try that.
I don't know that. I think binding is working fine. I don't know. I've never tried.
I believe you can.
I've never tried to actually cast for an individual that I knew. I have tried to dispel them from the house, and that seemed to be fairly effective for a period of time.
Yeah, for a period of time. Well, it might be something too that you have to work up to.
Yes.
Over a period of time, you know, cleanse things up and get rid of things and get the patient ready for something like that. But you don't have to yell and scream at them either. You don't have to imitate the demons to make them go. One of the things that Nazarene Act says about something like this is that the greatest resource that we have in dispelling darkness is our own dedication to holiness, scriptural holiness anyway. And I believe there's something to that. That's also Mark Rutland, if you know about him, great missionary, said pretty much the same thing, that the greatest deliverance ministry you can do is keep the Torah. because in keeping the Torah, you are providing the devil with a sinless pot in the first place. So yeah, that's amazing. Do you want to hear what Fred has to say? He had a little testimony when he got this disease at 69. Don't have time for much of it, just for a minute, and then we'll close up. Fred says, I'm preparing for a trip to nowhere. I'm mad, I'm frustrated, I'm everything in between. It's sure embarrassing. Maggie, it sure is. Can you imagine what it's like to have to think for 2 whole minutes before remembering your own grandchild's name? I'm beginning to find that out. A child I held in my arms when he was born and said, this, my boy, Robert, is a perfect child. I watched him grow and played ball with him, and now I can see his face in front of me like he's in the room with me. But when I reach for his name, there's nothing there. Blank. How do I convince an 8-year-old child that his grandpa loves him and cares about him when I can't even be bothered to know his name? Certainly that's enough. Children do not understand this. At about the age of 11 or 12, my cousin and I were taken to our great-grandfather. If I had a chance to do that again, what I would give for it. But what at the time, it was hot, and the old man talked real softly, and we couldn't really understand him. We couldn't figure out why we're there, but our parents put us there so we could have a last little time with this fine Pentecostal gentleman. And really, we got nothing out of it. We said, it's so good to get out of there. The opportunity was lost. This is also a good reason, if you find such people lucid, to get out your little portable recorder and talk about the past. They've got a lot to tell you still, even in that case. They have a lot that they can remember. And it's back before you can remember. I want to thank you for coming tonight. Our time is up. Many blessings to you until next time. Next Sunday night, we have a globe-trotting healing evangelist. I can't tell you his name yet because the interview isn't solid. He is a man who teaches pastors in countries where Christianity is illegal how to do healing, inner healing, deliverance ministry, and has brought hundreds, if not thousands, to a new understanding of what power they have, even when they're powerless. So put that on your calendar. That should be good. I should get that solidified this week. And again, I thank you, and I'll see you next time.